Good morning, everyone. Welcome to day 2 of the U.S. Center at COP28. This event is Regional Approaches to Climate Health, U.S. Leadership at Home and Abroad. And now I'd like to welcome to the stage John Balbus, Deputy Assistant Secretary for Climate Change and Health Equity at the U.S. Department of Health and Human Services.
Well, good morning, everybody here in Dubai. Good evening to all of those tuning in from the United States. Good day, wherever you are. I don't usually call for a round of applause when I start off something, but we are here today at the first event of the first thematic day, which just happens to be the very first health day in the history of Conference of Parties meeting of the United Nations Framework Convention on Climate Change. So this is going to be the start of a really fabulous day, and I just want to have a round of applause for the first health day ever at a COP, starting with us here today at 8:30. After we meet here, we'll have an opening session for the general thematic day for the COP, and later in the day, we're going to have a health ministerial meeting where over 100 countries have signed on to the first ever declaration about climate change and health to be had at the ministerial level. There are a million other events today to commemorate the importance and the centrality of health in everything we do about climate change. The convening of health ministers from around the world could not be more timely. We have seen in the last summers the devastating, whether it's Northern Hemisphere or Southern Hemisphere, the devastating impacts that climate change is increasingly having on human health, especially through increasingly severe extreme events. And so today's event showcases the fact that while federal governments have to come together, federal governments have to mobilize the resources, the solution space is much more local, and the federal governments have to be connecting to the states, to the provinces, to the municipalities, to the tribal and indigenous territories, and other territories and other jurisdictions in order to create the change we need on the ground to protect the health of people from the health impacts of climate change, especially those most vulnerable. For today's event, we are going to start with, we're going to divide it in two halves. The first half will be focusing on domestic actions that the United States has taken in fulfillment of the commitments we made 2 years ago to the COP26 health program. And we'll start off with a short set of announcements from our Assistant Secretary, Admiral Rachel Levine. And then we'll have a moderated conversation between myself, Admiral Levine, and Dr. Aaron Bernstein, the head of the National Center for Environmental Health at CDC. And then in the second half, I'll turn over the podium to Josh Glasser of the State Department, and we'll have a parallel discussion about U.S. partnerships to get the action down to the regional and local level there. So without further ado, let me turn the podium over to Assistant Secretary for Health, Admiral Rachel Levine.
Well, good morning. Thank you very much, Dr. Balbus. It is so great to be here. It is very exciting to be here at the U.S. Center on the first COP Health Day. We all know that climate change is actually fundamentally a public health issue. In this event, it is an important acknowledgement that health must be at the center of climate action. As such, I am honored to be able to announce the United States Department of Health and Human Services COP28 deliverables. The first is the announcement of the HHS Climate Change and Health Equity Strategy Supplement. This document represents a milestone for HHS, documenting for the first time in one place the actions that HHS agencies have taken in the last 2 years to address climate-related challenges. And it outlines what we're going to do in the future. This strategy captures the role the entire department plays in protecting those most at risk from the health harms of climate change, and it demonstrates our commitment to addressing the challenges ahead. Our next announcement is very exciting too. Since June of 2022, we have facilitated a collaboration between federal health systems, and this includes the Veterans Administration, the Indian Health Service at HHS, and the Federal Bureau of Prisons. And we're going to all work together on resilience and on decarbonization. It's been a great exchange to accelerate work in this area, and this group has jointly agreed to explore ways to reduce clinical greenhouse gas emissions by, for example, reducing emissions associated with anesthetic gases, reducing emissions associated with certain types of inhalers, and reducing medical waste produced in care processes. This should both result in meaningful progress for all of those systems and allow us to share our approaches and experiences with the private sector. Next, in 2021, HHS joined the COP26 health program. In the 2 years that have followed, the Biden-Harris administration has introduced a series of initiatives and resources to protect the health of people living in the United States and really globally from climate change. These include the White House HHS Health Sector Climate Pledge, which is a voluntary commitment to climate resilience and emissions reduction that includes cutting greenhouse gas emissions by 50% by 2030 and achieving net zero emissions by 2050. We have an update today. Currently, more than 130 organizations representing more than 900 hospitals have signed on. In addition to hospitals, pledge signatories include health centers, suppliers, insurance companies, group purchasing organizations, pharmaceutical companies, and more. The HHS Office of Climate Change and Health Equity, which we affectionately call OCHE, provides healthcare organizations working to address climate challenges with a number of tools and resources to support their work, and has particularly emphasized the opportunities for investments in resilience, clean energy, and building efficiency created by the Inflation Reduction Act. Last but not least, an update on our collaboration with England's National Health Service. We are working across borders to align procurement requirements for suppliers, particularly with respect to target setting and emissions disclosure as much as possible. We have been hard at work over the last year, and now we'd like to invite other countries. We'd like to invite other countries to join this effort. By aligning procurement standards around the world, we will make it easier and more efficient for healthcare supply chain to reduce its global emissions. Climate change is fundamentally a public health crisis. Strong actions by health ministries in the health sector around the world are critical to build resilience, combat climate change, and protect the health of the communities that we all serve. Climate solutions are health solutions. As you can see, there's a lot happening in the United States, and we remain absolutely committed to addressing the health impacts from climate change, and we look forward to the work ahead as we celebrate, though, how far we've come. Thank you very much.
It's truly an honor to work with you and to be working on all of these exciting initiatives together. Now we're going to unpack a little bit more where we started with the theme, which is climate solutions are health solutions, but those solutions really have to be embedded in local communities. And how do we do that as large national federal governments? I'd like to start with you, Dr. Bernstein. And could you tell us a little bit more about how CDC, in its various roles, helps to engage the state, local, territorial, and tribal governments in climate and health work?
Sure. Thanks, John. And I just want to underscore how wonderful it is to be here on the first health day at a COP, and honored to be able to be with you all. CDC is our nation's public health agency, and so the reality that climate change is embedded in our work speaks to what we're doing here today. We recognize that the actions that we need to take on climate change are based at the local level, and that's why our center, the National Center for Environmental Health at CDC, focuses so much on supporting state, local, and tribal health departments to build resilience to climate change, whether that's through the framework we have helped develop, the BRACE framework, whether that's through our grant programs that support some 13 state, local, and tribal health departments directly to work on climate resilience, or even broader programs that really focus on building the foundations of public health with a climate lens, because we know that to achieve our gains in health, whether that's about chronic disease burdens, infectious disease burdens, social determinants of health, we need to make sure that climate change is a part of those conversations.
Thank you very much. Admiral Levine? Similar question to you. How do we connect broader with HHS to the states, the municipalities, the tribes?
Well, I think that that's absolutely critically important. One of the lessons of the COVID-19 pandemic is that it's critical for local, state, federal, and international public health authorities to work really together. And to that end, we actually, as you know, have an Office of Regional Operations. And so we have regional health administrators throughout the United States that are working in those states and those regions and those local communities on specifically this issue. You know, we have to get the private organizations involved in the communities, in the states, and in the regions. This has to be a public-private partnership to be successful. And we have to involve the health systems, but all the other types of organizations that I mentioned, and particularly the supply chain. The supply chain is going to be key because actually in the health sector, which accounts in the United States for 8.5% or more of carbon emissions in the country, it's actually the supply chain that is the most critical aspect. So we have to get to that kind of granular level. And so that is why we created what I mentioned is the White House HHS Climate Sector Pledge. And as I mentioned, we have more than 130 organizations that are involved. And I'll give you a couple of examples. One is called Advent Health Orlando, which has installed more than 1,800 solar panels in its parking garage, and it anticipates saving $4.6 million in energy costs. It actually makes it the largest solar project in Orlando. Another is Valley Children's Hospital, which is the only level 2 children's hospital in the San Francisco Bay Area, between the San Francisco Bay Area and the Los Angeles Basin, which is quite a large geographic area. And they have completed their first greenhouse gas inventory, and they're moving forward with creating actually a renewable microgrid, which I know is really critical for hospitals and health systems to work on. And that was made more feasible through a CMS, which is Centers for Medicare and Medicaid Services waiver in March 23. So those are just a couple of examples of the local work that is so critical for us to get the job done.
Great. Thank you very much. Dr. Bernstein, back to you. You touched on this briefly about how climate change work is starting to be embedded across all of the different programs and divisions of CDC. Could you say a little bit more about CDC's vision for the integration of climate change and mainstreaming it in the public health mission?
Sure. Thanks, John, for that question. When I started at CDC about 6 months ago now, I was very fortunate to engage with an ongoing process to develop a strategic framework. So for the first time ever, CDC has a strategic framework to integrate climate across the agency. And so we're now putting that into action. And that really is about how we think about emerging infections and our work to be engaged in health security, not just in the United States, but globally, and thinking about how climate events affect our risk of emerging infections. That's about worker safety. That's about NIOSH. It's about how we protect farm workers from extreme heat and wildfire smoke. That's about chronic diseases, heart disease, the leading killer of people in the United States. How we need to think about as we try and continue to alleviate the burden of disease from heart attacks and strokes, how we need to think about the contributions of extreme heat and air pollution, and I can go on, but it's really an exciting time to be at CDC in that regard because we do have a whole of agency approach to climate, and we're starting to make really, I think, important inroads to protect the gains that we seek to achieve, right? So we're working to alleviate burdens of disease, to prevent disease, and making sure that as we do that, we're doing it in a climate-informed way.
Wonderful. And, I think that's a second theme for this Health Day at the COP. The first theme being connecting to the local action. But the second, and this is exactly why we're having this health ministerial meeting, is we're at a point now where the mainstream mission of health ministries, of public health agencies, of offices like yours, Admiral Levine, needs to be informed and be looking at its actions through a climate lens. And when we think about people with cardiovascular disease, for example, there is the need to protect them and to understand the medications they're on and the setting of heat and everything. But there's also the fact that the climate actions we're taking like the microgrids, like the power supplies, reducing the emissions from the health sector, have immediate and direct and enormous benefits to people with cardiovascular disease because of the reduction of air pollution associated with it. So getting that into the mainstream of the mission of health, the health departments, the health ministries in the world, is really, I think, one of the exciting things about today, is seeing that happen on a global basis. Admiral Levine, so your office of the Assistant Secretary, the Office for the Assistant Secretary for Health, has offices that work on infectious diseases, on reproductive health, on minority health. Can you say a little bit about how you see the work of climate change being mainstreamed across your offices and HHS more broadly?
Well, I think that that's critical. So I think it is really important for us all to collaborate, and that would include all of the different divisions within HHS, the CDC, as we've been talking about, but including NIH, FDA, and others, and actually within our Office of the Assistant Secretary for Health. As you know, and the office that you lead of OCHI, is that our office has been called, the Secretary calls us the connective tissue of the department, pulling together all those strands. Personally, I was hoping for the beating heart of the department, but I got connective tissue, so I'll take it. And so we really pulled together all those different strands across the department. So, for example, we're working with the Indian Health Service, and they have agreed to work on the same things that the private sector has agreed to in terms of resilience and in terms of decarbonization, HRSA and more. But then we have to actually go outside of our agency, and so we're collaborating with the VA and the Federal Bureau of Prisons. The VA is the largest health system in our country, to also work on resilience and to meet those climate goals. Also working on reducing, for example, I mentioned anesthetic gases, which turns out to be quite significant. Inhalers, asthma inhalers, and inhalers for other medical conditions actually release carbon. And reducing medical waste as well. So all of those things need to work together. It needs to be a public-private partnership. And in the federal government, we can't just talk the talk. We actually have to walk the walk as well.
Thank you. Back to you, Dr. Bernstein. So the Office of Climate Change and Health Equity, which I direct, has been given a mission very specifically to protect the health, not just of everybody in the United States, but especially a focus on those who are from disadvantaged communities, who bear the greatest burden of climate change health impacts. Can you say a little bit about how CDC has opportunities and is working to build the resilience of communities, and again, with that focus on those who have borne the greatest burden of the COVID pandemic and in general have the higher share of chronic diseases, et cetera?
Sure, and thanks for that question, John. You know, one of the resources that our center has developed that I'm most proud of is our Environmental Justice Index. This is the first of its kind index that actually considers the United States not just the economic welfare of communities, not just the social determinants of health, not just the environmental determinants of health, but also the health of communities in one metric. And that really shines a light on what you said, which is we know that the communities that may have the least resources to be resilient to climate effects are often those that are really most likely to get hit by extreme events that climate change is making more likely. And so we realize that we need to work at the local level, and we need to learn from communities across the country that are dealing with the reality of climate change. And so to that end, we support them. We have grant programs. We have also the opportunity to deliver tools that can be of value to them as they try and build resilience, whether that's our current heat and health tracker that gives a sense of healthcare utilization during heat events. We are working on deploying in advance of the next heat season the first of its kind heat risk tool that will be a forecast for heat and health up to 4 or 5 days before a heat event, which I think will be transformative in local ability to understand when heat events are going to be a risk for the population they serve. We have tools that can help employers understand heat risks as well. So we try and develop resources, and we also try and do research that will hopefully lead us forward to greater resilience, again, especially for those who have most at risk. I am very eager to use the incredible data science that we have across HHS to deliver on what would be the equivalent of what I would call a Framingham Heart Score for climate-sensitive diseases. So right now, an individual can show up to their provider and through just a few questions get a sense of their risk for cardiovascular disease next year. I think in order to improve our ability to do heat resilience, for instance, it would be extremely valuable for a provider to be able to ask maybe 4 or 5 questions and really understand, is this the person that we really need to pay attention to protect them from heat? And the last thing I'll say, again, in this relationship to local health departments, is that we're developing a best practices gateway. And I give a lot of credit to Eric Svensson, who runs our Division of Environmental Health Science and Practice on this, because he realized that one of the things we really need to do is improve connectivity across local health departments on what they are doing and innovating around climate resilience, which is really very exciting when you get close to it to see what's going on in communities across the country.
Great. Thank you for that. Admiral Lavina, our last question. So I want to first recognize and congratulate you for being named as one of Time Magazine's 100 most influential leaders on climate change. It's a wonderful honor. Hear, hear. Now, when you stepped into the office of the Assistant Secretary for Health, I'm not sure you would have been thinking that you would be recognized as one of the business leaders on climate change in the world. Could you say a little bit about the private sector, how we're working with the private sector, and what you think those private sector stakeholders should be prioritizing now?
Well, my mother always thought business school might be a good path, so I think she'd be pleased. It all fits together, right? This all fits together. First of all, this is a group honor, and your efforts personally, and Ochi's efforts, and really across HHS. So I'll take it as a team victory. But all of these issues fit together as we think of, quote unquote, the social determinants of health, and all those different factors that are not necessarily health care related that impact health. And then, of course, that involves the environment and the impacts of climate change. It also includes housing. It also includes transportation. It includes economic opportunity. It includes education and nutrition and more. And all of those different things are linked together. And you can see how climate change is impacting all of those, and I think that's how business gets involved with our work in terms of health and healthcare and public health. I'll give you a short example. Is that when I was in Alaska, we went to some of the remote communities in Alaska. We went to Nome, we went to Utqiagvik, we went to Savunga, and other remote Alaska Native communities, and they are all so significantly impacted by climate change in terms of the temperatures they have, the temperatures of the sea, and how that's impacting the ice pack, and it's impacting particularly the availability of their traditional foods. Their traditional foods in terms of the fish and mammals that they have to hunt to survive because they're subsistence livers. And so also we saw villages where their houses are falling into the ground, into the permafrost, because the permafrost is melting, and the tundra and all the different components are melting. So climate change is impacting in these indigenous communities all of their ways of life. Well, it's actually doing that all throughout the United States and all throughout the world. It's impacting our nutrition, our transportation, it's impacting our housing, it's impacting economic opportunities, it's impacting our health. And that's why climate solutions are health solutions. Thank you.
I think on those final words, we will end our half of the session. Thank you both so much for giving us your insights. And with that, what I'm going to do is call up Josh Glasser of the Department of State, who will be moderating the second half of our session. So thank you again. Thanks for this today.
Very good. If I could invite Dr. Kaseya and Dr. Carter to the front. Very good. Good morning. Good morning. Hi, I am Josh Glasser. I am the acting head of strategy for the brand new Bureau of Global Health Security and Diplomacy at the State Department. And I'm very honored to take on the international half of our program here We've already heard about regional and subnational approaches in the first half hour. The second half hour will look at how regional cooperation works on an international stage. I'd like to turn first to my principal deputy coordinator, Dr. Hillary Carter. And Dr. Carter, the State Department is famously divided into regional bureaus. We often think of the world very regionally in our work. Could you describe a little bit, as we think about climate and health cooperation internationally, how we think about regional cooperation and why exactly that is important to us?
Yeah, great. Well, first, let me just say it's really a pleasure to be here and to be here alongside DG Kasea. And I think we had a round of applause in the earlier session for this being the Health Day, but I feel like we need another one. Great. Thank you for that. And I know it'll be a really exciting day here. So I wanted to start first with three big messages on climate and health. The first is that when you think about the impacts of climate and health, you need climate, health, and also diplomacy to understand and to reduce the impacts of climate on global health. The second is climate issues, just like health issues, do not respect national borders. And then the third is that we need regional networks and we need to stay coordinated. It's very valuable to share experiences, to share solutions, and also to share ideas. So let me break this down just a little bit and maybe respond more specifically to the question on how the State Department works regionally. So state works regionally for many reasons, but when you think about climate and health specifically, one of the main reasons is that countries in the same region, they share the same ecosystems and they also share the same types of weather profiles. And it's good for information to flow in all directions. I wanted to talk a little bit about a project that we're supporting, and maybe if Dr. Chitaro joins us, you'll hear a little bit more from her perspective because it's in partnership with her. So this project is called Diminishing Dengue with Health Services, and it's being implemented in the Pacific. And the goal of this project is to advance climate early warning for health, to strengthen preparedness and response to climate-sensitive infectious diseases, and to strengthen resilience. And this partnership is with Palau, it's with the Marshall Islands, it's with Micronesia, and we've also, under the context of this project, hosted regional meetings as well with nearly all Pacific Island countries. And this is all to strengthen that climate and health nexus. And what we've seen from these engagements, we've seen some consistent themes emerge. Those themes that have emerged have looked at the nature of the risk profile, and how we can leverage or establish a dashboard to understand that risk so that we can take action. And I also want to say it's not just the technical content of this project, but it's also the networks that are established, those things that happen in the coffee room that can lead to really strong partnerships and collaborations after the meeting happens. And then lastly, I wanted to share another regional partnership that we're really excited about, and it's quite fortuitous that I'm here with DG Kasea, because just last week we signed a U.S. Africa CDC Joint Plan of Action, which is under the auspices of a memorandum of cooperation that Secretary Blinken signed with AU Commission Chairperson Faki. And this joint plan of action was announced in Lusaka last week, and will strengthen public health systems and improve health outcomes in Africa. And it will also look at institutional strengthening, at integrating health systems. There will be expert exchanges, and also actions to strengthen public health emergency response. And so we're really looking forward to that partnership and deepening it. And to illustrate the possibility of what this type of joint plan of action collaboration could lead to, this past August, we hosted a workshop that was in Nairobi, and it brought together African scientists and other funders of climate, health, and environment work to link the scientists with potential funding mechanisms. And I was really fortunate enough to spend a little bit of time with this group. And again, it wasn't just the technical work of that meeting, but really the connections that were found, that were made within that meeting. And so I'll conclude here. Hopefully that gives you all a sense of why and how the U.S. State Department works regionally. And I think maybe a last really important thought is that this Health Day hopefully will energize and serve as a jumping off point for future climate health coordination. Thank you.
Thank you, Dr. Carter. Africa CDC Director General Jean Kaseya, we're so pleased you're here. I know it's an enormously busy day. Let me give a round of applause for coming by and joining us here at the U.S. Pavilion. The Africa CDC, of course, within the context of the African Union, covers an enormous region. Perhaps you would say it's a region of regions because there are many different sub-regions within Africa that have different climate profiles and health profiles. But how do you, as a regional organization, think about taking this broad context of climate and health and then putting it into practice in your work as a regional organization?
Oh, thank you, Josh. Please let me first extend the appreciation of 55 countries of Africa. You know, I just came from CPHI, the Conference of Public Health in Africa. We had 5,100 people attending physically and 30,000 people attending virtually. It was the biggest public health conference in Africa. And we discussed the issue of climate change. And George, but let me also say that when we talk about Africa, we don't call Africa a region, we call Africa a continent because we have 5 regions in Africa. This is something we need also to understand because that one has impact because we have what we call the regional economic communities, and the 5 regional economic communities are under the continental framework, and Africa is at the continental level. We saw that there are 3 points we wanted to share today. The first one is Africa is so vulnerable to the climate change. We'll talk about it. And as Dr. Carter, I have to call her Hilary because we are friends, said there is no borders. The second one is what are solutions that we are bringing? And the third one is about the power of collaboration and partnership. When we talk about how Africa is so vulnerable to climate change, we bring it to a number of aspects. The first one is the economic aspect. I was talking with Adesina, who's leading African Development Bank, and he was sharing with me that every year Africa is losing 5 to 15% of our GDP due to climate change. It's huge, 5 to 15% of the GDP. Knowing that we come from COVID that affected our economies, knowing that we have 2 new outbreaks per week, and to be more concrete, from January 2023 to November 2023, we had 158 public health emergencies in Africa. This is huge. And if you consider that almost 75% are zoonotic, worsened by climate change, you can imagine how we are impacted by that. The second one is about when we say no borders. We saw what happened in Southern African region with the cyclone that affected our countries that now is translated to the worst cholera outbreak affecting 18 countries with more than 4,000 deaths. And this is something concrete. We can talk about the flood in Libya. We can talk about the earthquake in Morocco. Africa is so affected, and we can see in dengue in West Africa and the cholera in Southern Africa, there is no border. And that one is bringing us to think about a regional and continental solution. What are we calling solutions here? I told you 75% of zoonotic diseases worsened by climate change, we need a One Health approach. This One Health approach is what we are promoting now to bring all countries together under a continental framework to see how we are implementing. And this one is also changing the perception of financing the health system. Because initially when we were talking about financing the health system, we were talking about the Abuja Declaration with the 15%. But today we are bringing Minister of Agriculture, we are bringing Minister of Fishery, we are bringing a number of other ministries together. It means the concept of health is changing under the One Health approach. This One Health approach, we are also promoting a strong surveillance system, innovative technologies. We are using the power of the digital transformation. We are using also the sustainable financing model. In February, some of colleagues will be invited in Kigali for the Health Financing Summit that we are organizing in Africa. And we are also talking about engagement of communities because we need resilient communities. The third one is about the power of partnership, and I really thank the US government, all entities coming together. As Dr. Carter said, we already signed the MOC and now we launched the Joint Action Plan. We are all proud of that. And I thank her because she really took the lead to work with my colleagues and a number of colleagues, and today we are proud to have that. This Joint Action Plan is a clear message that the US is supporting Africa program, is exceptionally the climate change program. We are also bringing the power of working together in Africa with other regions. I think the 3 points that we raised, what is the issue, what are solutions, and the power of collaboration, this is the way to move forward in Africa. Thank you.
Wonderful. Thank you so much. I do not want to keep us too long from the events at the plenary session. However, if I could just ask for each of the panelists to give a last word. If there's one thing you would like the audience to take away from this panel, what is that one key message you want everyone to bring home with them? And all those online, of course.
So I'll go ahead and start. I think the power of partnerships and the need for international interagency when you think about within governments and intersectoral collaboration to achieve our objectives when it comes to climate and health.
Very good. Thank you. DT?
The US will not be safe if all of us we are not safe. And climate change is affecting all of us. And I totally agree with the assistant, the HS assistant secretary when she said, let us now talk about climate solutions for all of us.
Thank you so much. I really want to thank the entire panel, both the first half and the second half. This has been an incredibly rich discussion, a wonderful way to kick off Health Day. If you would join me in a big round of applause for the entire group. Thank you. And I believe at this time we would like to do a photo with all the speakers, so if I could re-invite the speakers from the first half to the stage. Thank you.